you know, stress is important, is vital. We've got to have it or we die. I mean, plants have to have a little bit of breeze and light and cool and warm or they don't grow, and neither do we. And we have a wonderful system of hormones in our body that are designed to help us cope and deal with stress. So we want to be able to respond to what we would call the alarm reaction. This is a survival technique. You know, the tiger's chasing us, the dog is about to bite us, the whatever is acutely bothering us, or you know, the stories about the mom whose child is pinned under a car and she's able to lift the car up and get the kid out. Enormous outrushing of these hormones, adrenaline, cortisol, noradrenaline, all these things that help us have energy and juice to be able to do this stuff. So that's the alarm reaction that increases what we call the adrenocortical secretion. And I'll explain what all that is in a minute. And the activation of the sympathetic nervous system. And what Jill was just talking about is the fight or flight. That's the sympathetic nervous system. Raises blood pressure, raises heart rate, gets the muscles ready to act, shuts down the digestive system, the reproductive system. That stuff, we don't need that in this moment to survive. We need to run, we need to fight, we need to do something. So that's the alarm reaction. Well then, the body's normal response is to come up with some other hormones to help balance that, because that's not supposed to go on forever. The tiger's coming, we run into our cave if we're cave people, and we're safe, and now we get to rest and digest, okay? The parasympathetic nervous system comes on. Heart rate goes down, blood pressure goes down. We start to have the digestive process actually work. And this is what all the exercises that we're doing today are meant to do, is to tune us into the parasympathetic side, because we run around on the sympathetic side all the time. That's really easy. We can activate this parasympathetic side with intention, the breathing, the relaxation, the other things you're going to learn more today. But this resistance stage, which is balancing this adrenocortical stress hormones, changes electrolyte and water balance and carbohydrate metabolism. And I'm going into this because you'll see why some of the symptoms people have when this goes awry start to come out. Carbohydrate craving under stress, okay? You need it to respond. And then if things don't get balanced properly, we go into the exhaustion stage, which people can be at, you know, various phases along the curve of exhaustion. But this is when now the poor adrenal gland can't do it at all. It's just burnout. And then you're kind of in trouble. So here's the anatomy. Here are the kidneys. They look remarkably like kidney beans. And the adrenals sit right on top of them. So in medical ease, renal is kidney, adrenal above the kidney, okay? So it's all Latin. They don't really have anything to do with your kidney function directly, except in Chinese medicine. If anybody had any experience with Chinese medicine, the kidney qi really deals with all of this, which is very interesting. But anyway, so you've got these adrenal glands that have, if you cut them across, they have a cortex and something called a medulla. And they're very small. They're about the size of a little, like a big walnut, perhaps. Not very big, but boy, are they important. The cortex, that outside part, makes this really important hormone called cortisol. It also makes something called aldosterone, which I'll describe what they do, and DHEA, dehydroepiandrosterone. We go to medical school so we can say words like that. And guess what? They're all made from cholesterol. That's the initial mother molecule from which all sex hormones are made, even estrogen, progesterone, testosterone. So there is a concern in some people's minds that this wild rush to get everybody's cholesterol as low as possible, you know, there may be some benefits with heart disease, but we got to look at the downstream effects on all the other things that we need cholesterol for. So just make that little statement. The medulla, that inner part of the adrenal gland, makes epinephrine, which is called adrenaline also, and norepinephrine. And you know, those are the really get-going hormones. Well, cortisol sounds like something we use every day. Cortisone, you got cortisone cream that you put on a rash. You take cortisone or prednisone inhalers for asthma. It's a major anti-inflammatory, very important. And it is activating. And we secrete this in the morning when we get up in a high level, and then lower through the day as we get toward bedtime and sleep. So that's what that word diurnal means, another medical impressive word. That it's high in the morning, lower in the afternoon, very low at night so you can sleep, comes up again the next morning to get you going. Dehydroepiandrosterone, or DHEA, anybody ever heard of this one? Okay, so this is, it changes through life. It's very low when we're born. It increases and peaks at around age 25 to 30, and then it starts to decline as we get older. And I see a lot of midlife women around hormone changes, and it's very interesting that a lot of women who are tired have a DHEA that, you know, say they're 50, their DHEA level is what somebody who's about 80 or 90 would have. You know, no wonder. No wonder I feel 80. My hormones are 80. Now, when DHEA is low, there's some very interesting consequences. There's a correlation of low DHEA with immune function being out of whack, getting more infections, so more susceptible to infection, and developing more autoimmune disease, where the body does not recognize that your tissues are really okay and starts to make antibodies to it. So autoimmune diseases like rheumatoid arthritis, lupus, Hashimoto's thyroiditis, etc. And then when it's low, people feel tired and can feel depressed. And it's interesting that there is quite a bit of research in both the psychiatric literature and the rheumatology literature that low DHEA in psychiatry correlates with depression. Improving DHEA can help mood. Low DHEA can correlate with worse symptoms of things like rheumatoid arthritis, and not that it's a cure, but raising that level can help the pain substantially.
Is it normal according to age? Is it
Yes.
really different? Like if you're 40, you should be...
Yes, exactly. So there are ranges by age. And what happens frequently is people are in their 40s or 50s and they should be around 100, let's say, and they're 15. I mean, really dramatically too low.
How do you test it?
We'll talk about
Okay.
that. Yeah, good question. See, you're a plant.
Aldosterone. We
Aldosterone.
have.
I'm mentioning this because it has important reasons why people have certain symptoms when adrenals aren't working. It's a hormone that's made in the adrenal cortex, and it tells the kidney whether there's enough fluid in the body. There's sensors all over your body to say, are we hydrated enough? If not, we got to hold on to salt, which holds on to water and keeps our water level and therefore our blood pressure up through a mechanism in the kidney. The kidney will either lose sodium and therefore water or hold on to it. So if we have not very much aldosterone, the kidney doesn't get a message to hold on to salt and water, and we lose it, and then we get low blood pressure, which can cause fatigue. And many people with adrenal issues do have quite a low blood pressure. So we've already talked about excessive...
They're on the low side? They're
Yes, usually on the low side.
And what do you call a low blood pressure?
Well, I'm talking about, 90 over 60, something like that. Now, some people have that blood pressure and they're fine. And, typically I say to people, the lower the better till you're fainting, And I have had people with adrenal fatigue issues whose blood pressure is not low, and in fact, we're treating them for high blood pressure. So it's not a 100% correlation, and it's not that low blood pressure equals adrenal fatigue, but it's very common to have that on this basis of the aldosterone.
I just have a question. Someone who has a low blood pressure like me, and I am as hyper as you can possibly think, and your heart's racing all the time. Does that make sense?
Yes, it could make sense. Okay. Yeah. All right, so we've already talked about stress. You're probably going to think, I don't want to hear that word one more time by the end of today. But it really is important. So it's that exhaustion phase. Too much stress, calling upon the adrenals for too long, now they can't recover. Inadequate sleep and rest, and that's because our adrenal glands get plugged in at night, like the Energizer Bunny batteries, to get recharged. And if we don't get enough deep stage 4, completely relaxing sleep, you don't build it back up. And so this is the biggest pillar of treatment, really, is better sleep. The whole issue of pushing too hard, all the things Jill's mentioned already, just not letting up, expecting too much of yourself. Chronic illness, because that's calling upon body reserves to deal with that problem. And then interestingly, chronic use of steroid medication. So people that have asthma and use inhaled steroids or nasal steroids on a long-term basis. We used to think, oh, that isn't really enough to suppress your adrenal glands, but it can be for some people. Not everyone, but there are definitely, I've seen patients and there's many cases of people who have used these steroids for a long time and then they stop them, and now their poor adrenal can't pick up the task anymore because the body's had this message, we've got cortisol, we've got enough of this, we don't have, the adrenal doesn't have to do it. And then if you take it away suddenly, you can't keep up. So, fatigue and unrefreshing sleep are some of the symptoms that we see with people with this condition. Salt craving. Can you figure out why that would be? You don't have the aldosterone, you're losing salt, your body says, oh, we need salt, we need it, and so you crave it. Low blood pressure, like we said. Carbohydrate cravings, because of that whole trying to fix carbohydrate metabolism, your body thinks carbohydrates will give it the juice that it needs, and probably that's about the worst thing to do, but it manifests itself in other ways. Muscle aches. Well, why? Cortisol is an anti-inflammatory, right? It's your own internal cortisone. So you don't have any, everything hurts more. And people often do have this evening recovery time. They don't feel very good in the daytime. Then they start to pick up in the evening. This isn't true for everyone, but it's something that is seen quite a bit. All right, so what if we don't intervene? What if you just go, I don't care, you know, I'm too busy to be bothered, I can't go to these workshops, and even I learn all these techniques, I don't have time to do them. Big problems. Your immune system can go bad and start developing autoimmune diseases. And I will say, in the 30-plus years I've been a physician, and I've seen a lot of people with autoimmune conditions, you talk to somebody about when were you well, you know, before this started, your rheumatoid arthritis, your whatever, and what happened in the interval between well and no. I would say 90+% of the time there's been some major stress. Very often emotional, sometimes physical trauma, that has precipitated the immune system to go against its own interests. Recurrent infections, particularly people then have trouble with respiratory tract, sinusitis, bronchitis, pneumonia. Asthma and allergies, again, you don't have your own anti-inflammatories. So you can get these inflammatory conditions. Body pain, including fibromyalgia. Even cancer, because we've all got cancer cells in our body, but our immune system, if it's healthy, is taking care of them, keeping them from becoming a problem. Our immune system's now on, you know, hiatus. It's on sabbatical. We can now start to develop a problem. And nobody wants premature aging, oh my goodness. So these are things that can happen. Oh my gosh, there's more. Chronic fatigue syndrome, which is becoming a little bit better understood, but not a fun thing to have. Hypoglycemia, this is that carbohydrate craving and the whole carbohydrate metabolism being off. And hypoglycemia is the first stage in a long course toward diabetes. So it's not just a benign thing, it has to be dealt with. Ischemic heart disease, alcoholism, big example of carbohydrate craving, okay? 1 carbon sugar, alcohol, ethanol. You know, it's the simplest carbohydrate we've got. So this may be one of the reasons people are trying to treat themselves with alcohol. And then difficulty rebounding from any kind of injury, surgery, illness. So we're going to come back to this breath practice, I think, in a little bit, because I want to give you a few examples of real people. All right? So this is a real patient of mine who was a nurse who worked night shifts in a local hospital. She came in complaining of fatigue and unrefreshing sleep. You're getting the picture. She had thyroid nodules and she was hyperthyroid. She was being treated with medication for that. She also had metabolic syndrome, which is that central obesity, cholesterol that's out of whack, high blood sugar, and she was having a lot of trouble losing weight. We're going to come back to her after we talk later about what we did. Second case is this attorney, 33-year-old, who had 3 babies in 4 years. There's a little bit of a stress to your system, I would think. Very fatigued, unrefreshing sleep. She's craving carbs and milk for some reason, I don't know. She had cravings for milk. She had allergies and asthma since childhood. And she took steroid bursts, prednisone bursts, as well as inhalers, nasal sprays almost all the time. So she's somebody on chronic steroids. She had recurrent respiratory infections and sinus problems, 3 sinus surgeries. And we're not talking little sinus infections. She had a lot of trouble. She had a tiny little dose of cortisol, and we'll talk about what the level should be, but basically it was undetectable, probably because of taking steroids so much. Her DHEA should have been 300 for her being in her 30s. It was 20. No wonder she's tired. She went to an endocrinologist and he felt that she had adrenal suppression probably because of the chronic use of steroids. Plus, stress. She's got 3 little kids. She's trying to be an attorney. I mean, oh my gosh. Hello. And then there's this mom triathlete inspirational coach. Anybody you might know? So her story was, you know, in 2002 she had a 4-year-old and a 1-year-old. She had given birth in the previous year. Both of her kids had gotten sick enough to have to be in the hospital. Her father was very ill. She lost a very dear friend. And she did triathlons between the pregnancies. This Miss Overfunctioning person. She was exhausted, but her mind was running. Just very anxious. Her family and friends thought she was really anxious. We have her permission to talk about all this. Her cortisol was low on one test and high on another test. So it was kind of confusing. And that can happen. Then she started to decide to make some lifestyle changes. She got pneumonia. She traveled internationally being an inspirational speaker. She was exhausted but kept pushing. Lots of infections. Running marathons when you feel like this. The last few years, more lifestyle changes, more sleep, and she's improving. And so she is going to talk about her own self-care here for a minute.